Dr. Patterson here, and in this video I'm going to talk about the relationship between the colon and disease. You need to understand and remember, keep in the back of your mind, that all diseases are caused by a combination of stress, dehydration, and malnutrition. And it starts in your colon, regardless of the name given to the particular chronic ailment that you may have been diagnosed with. It still starts. There's a relationship between that condition and a compromised immune system resulting from dysfunction in your colon. So, and then once you understand this, then you'll understand that the only thing that can cure this here, and we're saying cure because drugs will not cure it. Drugs will manage it. It can manage, but you still have the condition. The only thing that can cure this, it would be diet. And then there's some other adjunctive care that can be given along with the change in diet. But the primary therapy is going to be dietary care. So in previous videos, I've pointed out the anatomy of the colon along with other structures in the internal area of the body. But we're talking about the digestive issues, stomach, moving into the small intestine, which is about 20 feet long, and then the undigested carbs, fats, and proteins from the small intestine that will move into the large bowel. Okay, and so once it does that, then you have about another window of 8 to 10 hours of this waste matter being should be eliminated from the area. So we're looking at an area where you can store waste matter for a short period of time, and then once it's stored, it's going to travel through. If there's water in the food that you consume that's going through the digestive process, it should move in a timely fashion through the large bowel for to be exited. If it does not do this, if for some reason this bowel will back up with waste matter and you continue to eat, that's the most dangerous thing, is when the bowel is full and the small intestine is still digesting food. See, and it's full. We're talking about 20 feet plus another 5.5 feet. So you got 26 feet of solids, semi-solid food in the colon, and then you eat and fill up the stomach. See, and it takes about 4 to 5 hours for the stomach to empty into the contents of the stomach, to empty into the small intestine. Now we're looking at a serious health situation because there's nowhere for this waste matter to go but out from the bowel and allow that 20 feet of colon undigested waste matter to move in. See, and it's moving into a smaller area in terms of length. It's larger in diameter, and this is why you see a protuberant abdomen. It's not all body fat. A lot of times the colon will swell to accommodate this waste matter that's trying to move from the large bowel, move into the large bowel from the small intestine. See, so what you're seeing in the picture, we have a detox tea. There's so many people that have an aversion to colon therapy, enemas. It's just that's okay. Okay, we've done so much good, and colon therapists around the country and around the world has done so much good and have benefited so many people by removing this undigested waste matter, not allowing it to back up and cause disease. You look at your autoimmune diseases, lupus and sarcoidosis, diseases like that, certain forms of arthritis. A lot of this is coming from the bowel. So what happens in terms, just in short, when we talk about physiology, think of your colon wall as a picket fence, and a picket fence that has no spaces. So what happens is when you don't eat fiber, a fiber-rich diet, that fiber is supposed to support the bacteria in your colon, the microbiome in your colon. If it does not do this, then this microbiome starts to feed off of you. And the first thing that it will do is it will compromise the mucus layer. Here, mucus is good. So we've had patients talk about they want to get rid of all their mucus. Well, that's not such a good idea, because there are places where mucus is a protective barrier between certain tissues. This is very important, because once you lose the protective barrier between the bacteria and the colon wall, now the bacteria, your own natural, normal flora, will start to eat through that colon wall, to start to eat you. And this is what I'm talking about when we say that look at the colon wall as a picket fence. Once you start to get holes in it, that's like removing the slacks in that picket fence. Once you remove that through erosion, then now you can get leakage. And this is where leaky gut comes in. See, leaky gut is unwanted proteins, unwanted waste material that enters the bloodstream because there is a defect that's caused by not having enough fiber in the diet. And thus, it doesn't feed the bacteria, your microbiome in your colon. And when this does not occur, and the microbiome begin to feed off the mucus, erode away that mucus layer, and then it begins to erode away the tight junctions, is what it is called. Think of that as the picket fence. Now you to start removing slacks in that picket fence. You have holes in it, gaps. That's how the waste matter, undigested waste matter, undigested proteins enter into the bloodstream. When it enters into the bloodstream, the first thing, that organ that has to pick it up is your liver. And the liver is not supposed to detoxify waste matter that it once detoxed already. See? So we put together a tea, a men's tea, which proprietary blend of herbs, is for male problems below the navel, bladder, prostate. It's not curative. It's just to remove this waste matter, but it has a secondary effect to it. Same thing with the women's detox tea. You have your base, herbal laxative, and a proprietary blend of herbs that helps to remove the sludge, dead tissue and cells that might compromise the bladder, the uterus in that area in women. And you might begin to see a change in the symptoms caused by hormonal dysfunction in women, such as hot flashes. See, men might begin to see a reduction in urination at night. You may not, but either way, the whole purpose of this is not for medicinal purposes. It's to remove the waste matter, and that's an added benefit. So when we look at the colon, there's so much going on in this area that pathology has now set in. We see a rise in colon cancer. There's so many issues such as diverticulosis. Okay, this is the pouching that we see that can collect waste matter, namely seeds. This is why seeds are foods that contain seeds are contraindicative. Polyps develop. Most polyps, if they're caught in time, are precancerous, but they're benign. They can be snipped off. But we noticed that our patients who had colon therapy, when they went back for their follow-up from colonoscopy, they may have presented for that test initially with 8. We've had some that had more than 8 polyps that were found that were snipped off. And none, they were lucky, none were malignant. 4, 5, 6. And when they had a regime of colon therapy, when they went back, 0 incidence of polyps. So it's not the colon therapy that's the cure. It's the removal of this waste matter, not allowing this waste matter to sit there for any length of time to erode away the colon, to cause irritation, to change the cellular structure, allowing for cancer cells to develop. So this is the problem, is the waste matter sits there too long. So that's the purpose of this tea. The tea is to help you when you get become irregular, to move that waste matter out in a timely fashion is not addictive, is mild. The whole purpose is to make sure that whenever you feel the need or you don't remember whether or not you went to the bathroom for a movement and you've eaten the standard American diet, 2 to 3 meals in the course of the day plus snacks, and you didn't go, you're in trouble. You need help. So we're putting something together here for patients who have some sort of problem with colon therapy. It might be just fear, or things that you've heard. It's okay. You still, nonetheless, have to remove that waste matter from the bowel. So once that waste matter is removed, then you lower your risk of having some sort of obstruction that can take place. You lower the risk of having some sort of infection, whether it's bacterial or viral infection taking place. This is extremely important. Now, when we look at what you're eating, once the waste matter, depending on what you eat, it should be about 70% water, and 30% mass. That's undigested materials, that's dead cells, that's food residue, that's cellulose. This is all supposed to be discarded by the body. We know this is not the case because we can look and tell from the emptying that's taking place during the colonic procedure that this person's diet doesn't contain the balance of 70% water and 30% solids. So the bulkier the waste matter, the faster it's going to travel through the colon, the less pathology, or the less the risk. You lower the risk of pathology setting up in the colon. And when you expose this, the exposure of this waste matter in a timely fashion, you begin to feel much better. That's why you feel better, because the colon stretches, and now it can resume its normal anatomical and physiological shape once the waste matter has been removed in a timely fashion. So bowel management is very important. The digestive organs, when you have timely movements, you don't strain your digestive organs. You don't get a backup of your digestive organs. Also, you don't get a backup and overwork your detoxification organs like your kidneys and your liver as a result. So bowel function is extremely important. The laxatives we don't like to give. We don't like to look at this detox as to be used as a laxative, but is to be used as a somewhat of a semi-emergency situation. Okay, so now autoimmune disease. Autoimmune disease is colon disease that we've already explained it with, like the picket fence scenario. When you get undigested proteins that leak back into your bloodstream, and your liver is already trying to detox food that you have currently eaten, you're going to get free radical formation. See, this is what we're looking at. These free radicals can be linked to precancer. It can be linked to poorly recognized or recognition of the body's own proteins in that area. And when you can't recognize that the body's natural antibodies will go to attack what belongs to you. So that's what autoimmune disease is. See, when the body doesn't recognize its own cells, and there's nothing wrong with the cells, they're just in the wrong place at the wrong time for too long a period of time. That's what the problem is. So you have to get that out in a timely fashion. That's imperative. You have to change the structure of the foods that you eat. The time that you consume this food is very important. So when we look at people and we look at, there's so many classifications of dieting today, it's very confusing. But the healthiest people are the fruitarians. Fruitarians have basically a 90% water-based diet, see, and 10% solid. which also contains water, and it's removed in a timely fashion. They don't need colon therapy. They don't need detoxification herbs or anything of that nature to assist them. That type of water is going to form such a bulky colon residue that it will pass in a timely fashion. You're not as hungry. Most of the reason why you're eating so much food and you get this backup is that the type of food that you consume are addictive, and they stay with you because there's no water. If you cook foods or have foods that are cooked that you have to add water to them, that's dehydration. That's one of the causes of death. See, you're dehydrated. Then when you're dehydrated, then you're going to run into starvation. Your cells become starved. The cells are not getting the nutrition that they're supposed to get. See, then you could be exposed also to the chemicals that make up the foods that you just consumed. Exposure of chemicals, all sorts of coloring additives, what have you. The body has got to process that. Your liver first. It's got to process this and try to rid it. If this, in the processing of this food that's contaminated, I use the word contamination because it's not real food. It's contaminated with all sorts of additives, all sorts of colorings, enhancers, anything that's been emulsified, anything that has been fortified, stabilizers. Just look at some of the things that you consume. And the fact that you have to drink all this water lets me know that you're suffering from dehydration. You should not have to drink 8 glasses of water. I know that's what it said. But if you consume that type of diet and you have that type of backup in your large bowel, you need water. The only water you should really be getting is water from the fruits that you eat. And this is why fruitarians are so healthy, and they possess less risk when it comes to certain diseases. It doesn't mean you won't catch anything or contract something, but the risk is so much less. It's reduced. Then your vegetarians are next. The vegans, I'm not promoting that because veganism later, I think in either the 40s or early 50s, veganism wasn't based on diet. It just moved to that scenario of diet. And we found that many of the vegan foods actually contribute to some of the constipation, some of the issues we found in the colon: irritable bowel syndrome, colitis, constipation. Constipation being is not the absence of a bowel movement, but the passage of a dry, hard stool. That's a definition of constipation. So you can still be going, but if you have to strain so hard to get a small amount out, a pencil stool, you're constipated. That's what constipation is. And so we found that, I tell patients who are vegan that they may need to be mindful of their colon. And so it's a problem because trying to sustain a diet like that, they run into many problems, but the biggest problem is the colon. So that's where you have to look when you find that you have symptoms that won't allow you to sustain a vegan program. So we've looked at auto intoxication. We have the tea there. That tea will get you through, but the main thing that you need to do is help that tea to be beneficial by not allowing the foods that you consume to have fecal material that's so hard due to poor dietary habits. So your dietary habits must be changed so the accumulation of waste matter in the bowel and on the bowel wall does not lead to unhealthy bacteria that can start to attack your good bacteria. So we found that patients have all sorts of things that occur. If you're taking medication, certain medications will cause the dehydration in the bowel, also with the food, and so you'll be constipated. There's some that will give you diarrhea. Diarrhea is not good because that's a bacterial infection. Okay, so if you're taking antibiotics for a bacterial infection and you develop diarrhea, then you still have to rehydrate the colon. You still have waste matter that's there. So this is the reason why when we administer colon therapy to patients with diarrhea, they're wondering, why am I doing that? Because they feel that they're all cleaned out. They do feel somewhat better because the infection is gone, but they just really let out a lot of infected water. So once they get that, get the colon therapy done, they cannot believe, and they're amazed at the amount of waste matter that was retained in the colon. See, so you have to have that done. But also, when it comes to taking the tea, make sure that you put the natural normal flora back through cabbage and certain types of foods that ferment. Make sure you put this back, okay, because the toxins and the poisons and that nauseous debris that it can seep through the bowel wall, but you retain some of it in the colon. When that exits, then you have to repair the colon wall, and the best way to repair it is by starting with certain types of foods, like I said, fermented foods that will help to feed the bacteria. The gut wall will be repaired. You have to feed your normal natural bacteria. You have to build up that mucus layer to protect you. Okay, so that's very important. Now, constipation, I mean, millions of people in this country, we're just looking at the United States, they suffer constipation. And it's, we look at cancer. Cancer will supersede of the bowel. It will supersede heart disease pretty soon. Okay. See, and so it's the number 2 cause of death, in the United States, and people die every year of this. It's not readily spoken about, so you have to make sure that you keep tabs on the content of water in the foods that you eat. If you have to add water to it, you already suffer with dehydration. That's no good. You want foods that when you consume it, it has 70 to 80 or 90% water in them. So that way you'll feed the bowel. You won't be dehydrated. If you're suffering with dehydration, just drinking water is actually bad, because, it's good to hydrate yourself with the water, but now you begin to dilute the nutrients in the food if you eat food that's nutrient dense. So we want water in the food, not so much water that we drink, unless it's absolutely necessary. See, so this is something that you need to pay attention to. I want to make sure that you got some information. We're just getting you started. This is really like a very basic, almost a remedial talk on the colon. Is very, very, very basic. Is to get you started, make you aware. And we found out that once people become aware, if they get the knowledge and information or the data, once they become aware, they begin to question some of the things that they're doing, their habits, their life, and then they'll start to implement changes. Once you implement changes, you need to have a starting point. Where do I start? What change do I make? You start with your food. See, you start first with detoxifying the colon. Never start or change your diet without emptying first. That's very important. So I hope this has been some sort of informative presentation for you to give you an idea as to what you need to do if you're trying to make a change. The adage is always consult with your physician. Being a physician, a chiropractic physician, you can consult with me, and I'll tell you whether you need to talk with your PCP, because basically if you're getting medication from the PCP, they may be resistant or they may not be as helpful as you may be looking for regarding information with a change in diet. We found that many are receptive, but the problem is that this medication, depending on what it is, you may not need it after a period of time. So, but you can take it along with this here. That's what you want to find out. You want to find out, can you mix this tea or your herbs, your vitamins, your minerals with the medication? And the answer is, it depends on the medication. See, so you can talk about this or discuss that with your PCP or me or any other healthcare professional. But this is something that's very safe, it's very mild. It'll get you started. And then we begin the process of changing our intake of foods, changing the amount of calories that we take in based on the type of foods that you're eating. Don't be alarmed at some sort of shock to the system. The body will respond because keep in mind that your body is used to sugars and grease and excess salt, and you do this several times a day. And when you deny the body will go into a certain little crisis, and the crisis is usually resolved when you poop. So keep that in mind. But anyway, if you want information, I'll leave about the tea. I'll leave that in the link, and then you give us a call and let us know if this has been helpful. All right, thanks. Blessed in health.